सभी को मेरा नमस्कार। आज एक नए व्याख्यान को लेकर हम प्रत्येक शुक्रवार की तरह आज भी आपके सामने उपस्थित है। और आज आप सभी को विदित है कि हम स्पीकर्स का धन्यवाद हमेशा लास्ट में करते हैं, अंतिम चरण में करते हैं। मगर जब अत्यधिक यानी इमरजेंसी में अगर हमें कोई स्पीकर को अरेंज करना पड़ता है और स्पीकर महोदय हमें या महोदया हमें तुरंत उनके लिए हाँ बोलते हैं, तो हम अग्रिम धन्यवाद भी करते हैं। तो आज के स्पीकर का मैं अग्रिम धन्यवाद करती हूँ कि आज किसी और स्पीकर का लेक्चर था मगर कुछ कारण से वो आ नहीं पाए। और श्री हर्षा जी का मैं आप सभी पार्टिसिपेंट्स को बताना चाहूंगी कि पूर्व में भी उनका मैंने इमरजेंसी में लेक्चर करवाया है और वो रसायन के ऊपर है, एक्स्ट्रा ऑर्डिनरी लेक्चर है। तो आप सभी को वो भी सुनना चाहिए। और आज के लेक्चर जो है उसका टॉपिक है स्ट्रेटजीज फॉर सक्सेसफुल आयुर्वेदा ओपीडी प्रैक्टिस। मुझे लगता है ये एनसीआईएसएम को सिलेबस में रखना चाहिए कि आयुर्वेद की ओपीडी की सक्सेसफुल कंडक्ट हम किस तरीके से कर सकते हैं। तो बहुत ही बढ़िया आपने टॉपिक चुना है, बहुत रिलेवेंट है। हमारे 10 साल से चलने वाली इस व्याख्यान माला में जो एक उद्देश्य है कि हमारे स्टूडेंट्स, हमारे स्कॉलर्स नॉट अ जॉब सीकर बट जॉब प्रोवाइडर, है ना, वो कहीं जॉब ढूंढे नहीं मगर दूसरे को जॉब देने वाले बच्चे हो। देने वाले मीन्स दूसरों को बुलाए कि इधर आ थोड़ा ये काम है, चलो करो, है ना, मैं तुम्हें इतना इंक्रीमेंट दूंगा, इतना सैलरी दूंगा। तो कितनी बड़ी बात है कि हम भारत में कहीं ना कहीं बहुत सारों को जॉब में इन्वॉल्व भी आयुर्वेद के माध्यम से कर सकते हैं। तो बहुत ही बढ़िया आज का टॉपिक है। और आज के टॉपिक को शुरू करने से पहले मैं आप सभी के सामने आज के स्पीकर का परिचय रखना चाहूंगी। आपका नाम है डॉक्टर श्री हर्षा केवी। आप एमडी इन संहिता, एमए संस्कृत भी है, डिप्लोमा इन पंचभौतिक चिकित्सा। और आप अभी वर्तमान समय में है प्रोफेसर इन द इंस्टीट्यूट ऑफ आप्यम इंस्टीट्यूट ऑफ द आयुर्वेदा बेंगलुरु। आप कंसल्टेंट भी है साथ में श्री तुलसी आयुर्वेदालय, वो भी बेंगलुरु में है। और मैनेजिंग, यू आर आल्सो मैनेजिंग ट्रस्टी एट आप्यम आयुर्वेदा फाउंडेशन। आप्यम का अर्थ में अभी डॉक्टर साहब से डिस्कस कर रहे थे, तो मुझे बहुत ही सुंदर लगा कि आधुनिक विज्ञान में भी कहते हैं कि जल में ही सबसे पहले सेल की, एक वन सेलुलर की, कोएसर्वेटस की उत्पत्ति हुई और उसी से आगे फिर हम प्रोग्रेस करते गए, यूनिसेलुलर टू मल्टीसेलुलर एंड देन ऑर्गन्स, देन सिस्टम। और ट्रिलियंस ऑफ सेल इकट्ठे होके हमारे शरीर में काम करते हैं। तो कहीं ना कहीं बहुत अच्छी शुरुआत है। आप्यम के माध्यम से आप बहुत सारे महिलाओं को आयुर्वेद सिखाने के लिए भी सामाजिक कार्यों में उद्यत है। तो मैं चाहूंगी कि वो भी आप अपने हमारे आज के लेक्चर में बताएं, जिससे आयुर्वेद अंत तक पहुंचे। और छोटे से छोटी बात में प्रत्येक व्यक्ति भारतीय को आयुर्वेद याद आना चाहिए कि ऐसा है, आयुर्वेद से हम कैसे उसको रोक ले। तो ऐसी भी आप बहुत सारी सामाजिक चेतना जगाने की बात करते हैं। तो मुझे लगता है कि वो भी बहुत सारा इम्पोर्टेंट पार्ट है। आपने अपनी बीएमएस की पढ़ाई श्री श्री कॉलेज ऑफ आयुर्वेदा साइंस एंड रिसर्च से 2011 में की। आपने पोस्ट ग्रेजुएशन की पढ़ाई एसटीएम कॉलेज आयुर्वेदा हॉस्पिटल हसन इन 2014 में आपने पूरी की। इसके सिवाय आप बहुत सारे कार्यक्रमों में जुड़े हैं जो आप्यम के माध्यम से, ये सारा मैंने आपको सभी को बताया ही। और इसके साथ साथ आपकी अचीवमेंट्स भी है, मैं ब्रीफ में सभी के सामने रखना चाहूंगी। Awarded with the Agnivesh 2014 for outstanding performance in the academics, healthcare services and co-curricular activities during the post-graduation study, awarded on the 27th February 2014 on the occasion of the Tarang 2014 on the annual day of the institute. And you are also facilitated as a best alumni for the contribution in the field of health services and education in the Ayurveda at the समवाय 2016। और आपने बहुत सारे स्टेज पर आपने अपने व्याख्यानों को दिया है। आप बहुत सारे एकेडमिक एक्टिविटीज को कोऑर्डिनेटेड किया है। और मैं चाहूंगी, आपके शिष्य भी इतने जबरदस्त हैं, उनमें से बहुत सारे हैं, तो मुझे अभी एक नाम याद आ रहा है, डॉक्टर तेजा, वो भी आप ही की तरह है। क्योंकि मैंने किसी साहित्य में पढ़ा था कि गुरु का काम चेले बनाना नहीं है, गुरु का काम गुरु बनाना है। यानी हम आगे अपने शिष्य को इतनी गुरुता से बनाते चले जाएं, और वो आप ऐसा कर रहे हैं। क्योंकि जैसे ही आपने डॉक्टर तेजा का और इन सब का नाम दिया, तो मुझे लगा था कि बहुत यंग एज में है अभी, है ना, तो कैसा बोलेंगे, मगर एक्स्ट्रा ऑर्डिनरी और बहुत अच्छे क्वेश्चन आंसर। तो मुझे बहुत अच्छा लगा कि आप अपने जैसे ही प्रतिभा बनाने वाले लोगों को चुनते हैं, आगे बनाते हैं और उनको आकार देते हैं। एक बार परम आदरणीय सेक्रेटरी सर कोटेचा जी ने, पद्मश्री है जो भाई साहब, उन्होंने भी ये कहा था कि उनके गुरुजी आदरणीय प्रोफेसर गुरदीप सिंह जी सर, कि मेरा काम है 100 गुरदीप सिंह बनाना। तो कोटेचा सर ने कहा था कि कोटेचा सर का काम है 100 कोटेचा सर बनाना। तो आपने तो वो बनाना शुरू कर दिया है कि जो श्री हर्षा के साथ साथ इतनी कैलिबर रखे। तो ये बहुत अच्छी बात है, और सामाजिक रूप से भी आप अनेक मंचों पे कार्यरत है। मैं चाहती हूँ कि इन सभी बातों को मैं इसलिए कह रही हूँ कि हमारे पार्टिसिपेंट्स में से भी सभी लोग इससे प्रेरणा लें कि आयुर्वेद किस तरीके से आगे बढ़ सकता है। तो ऐसे विद्वान स्पीकर को इमरजेंसी व्याख्यान में हाँ कहने के लिए अग्रिम धन्यवाद करते हुए मैं आज के व्याख्यान के लिए बुलाती हूँ। वेलकम डॉक्टर श्री हर्षा केवी जी, ओवर टू यू।
बहुत बहुत धन्यवाद मैडम। हाँ, एक्चुअली इतने प्रशंसा की हकदार मैं नहीं हूँ, फिर भी मैडम ने बहुत तारीफ किया मेरा। पर ऐसा है कि मैडम के लोग जैसे लोगों की वजह से, मतलब गुरुगण की वजह से हमें इतनी प्रेरणा मिली है, और आयुर्वेद की सही ज्ञान हमें मिला है। मतलब हमारे जो यंग जनरेशन है, मतलब अभी 10-15 सालों में हमें बहुत अच्छी दिशा मिली है, ताकि हम आयुर्वेद को ठीक तरह से प्रैक्टिस करें और उसको आगे बढ़ाए, और हमारे नेक्स्ट जनरेशन भी उसको अपना रहे हैं। तो ये बहुत खुशी की बात है, और लोगों में इतना सारा इंटरेस्ट है। जैसे हम अर्बन सिटीज में देखते हैं, स्पेशली यहाँ साउथ इंडिया में, तो बहुत बहुत अवेयरनेस है आयुर्वेद के ऊपर, और बहुत सारे लोग आयुर्वेदा ही पूछ के आ रहे हैं। इसलिए हमें अभी एलोपैथी का कुछ देने का मतलब वो चांस ही नहीं मिलता, क्योंकि अगर हम कोई भी दवाई थोड़ा एलोपैथी का अगर जैसे भी थोड़ा शुरू करने के लिए मतलब या फिर करे, तो लोग ही हमें रोक देते हैं। तो ऐसा इतना अवेयरनेस है यहाँ पर, तो इतना अवेयरनेस हो रहा है आयुर्वेद के ऊपर। ये सब ऐसे मैडम की जैसे लोगों का गुरुगण का आशीर्वाद है, और उनका प्रेरणा है। तो मैं आज अपने व्याख्यान एक छोटी सी प्रार्थना से शुरू करना चाहता हूँ। ओम नमो भगवते धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्री महाविष्णवे नमः। My humble pranams to my all my gurujis and most respected हेतल मैडम, बलदेव सर मेरे जो पीएचडी गाइड है वो, और and all the participants who have been joining for the lecture series of VAP Jaipur, and also all the members who are present right now today. Thank you very much for joining. It is quite difficult to join at this particular time because of course the evening times are very busy for every practitioner, but in spite of that the lectures are so interesting that everybody wants to join. I know nobody wants to miss this chance of getting knowledge. So I would like to give my best during this presentation of 1 hour. So I'll be talking mainly which has been inherited by me by my gurus. So first of all, I would like to thank my one of my gurus, Dr. Mallika KJ, who was also a student of Baldev Kumar Dhiman sir. She was a PhD student of Baldev sir, and she did her undergraduation in SDM College of Ayurveda Udupi and post graduation in IPGTR and RA Jamnagar. And she was my teacher and PG guide for 3 years, and she had trained me completely in the way, in the perspective of Samhitas and to practice Ayurveda. So of course she passed away at a very young age, at the age of around 43, due to a road accident. But she always inspires us through her work. And in this presentation also, I have included many of the concepts and principles which have been taught by her. And also further on, I have been learning with a lot of people, like Dr. L. Mahadevan sir. He was also a very kind-hearted person who taught me for 2 months. He trained me for 2 months during my internship in 2011. And also many of the scholars, especially in it may be all over India. I have traveled all over India and sought the blessings of many of the gurus, Ayurveda gurus. So by offering my pranams to all my gurus, I would like to start my presentation. The strategies for successful Ayurveda OPD practice can be titled as Praveshika Shishti. So what is Praveshika Shishti? Praveshika means the marga, that is Chikitsa marga, it is called. Praveshika is also called as Vishikha. We know that Vishikhanu Pravesha is a terminology given to the convocation, right? Vishikhanu Pravesha, it is called. This was coined by Acharya Sushruta. In there is a chapter called Vishikhanu Pravesha Adhyaya. So Vishikha means Karma Marga or Chikitsa Marga. So the Karma Marga for us is doing Chikitsa. That is how we do our karma and then attain Dharma, Artha, Kama and Moksha. So Vishikha has to be done in a proper way, and there should be Shishti. Shishti here refers to a particular method in which it is done, which is principle based and also ethical and practical. So this is called as Shishti. So therefore, we were going to study about the strategies which are practical, ethical, and also which are principle based. Because any success should not be based on any other modifications. It should be always ethical, and it should be motivative, and also it should be very, very standard, and it should be based on the principles of Ayurveda. So therefore, we will see that what are the main prerequisites for a Vaidya for having these particular qualities. So the first thing what we have to do is Adhigata Tantra. That is, we have to study our Shastra. So if the Shastra has been studied well, then we will have a lot of confidence. Then Upasita Tantrartha. That is the Tantra Artha. Tantra is there. What is Tantra? Tantra Prayojana also we know. Dhatu Samya Kriya Cha Ukta Tantrasya Asya Prayojanam. Acharya Charaka has given this to us. But Upasita Tantrartha, that is, we have to have practiced the Tantra Artha. That is, what is the actual meaning that is in between lines we should have already read, and we should have practiced it and practically noted it down at the present. In Vartamana, we have to know what is what. So this is very important. The third one is Drishta Karma. We would have practical experience. We should have done it. Only then we can speak about that. Then we should have Shuchitva. Shuchitva refers to Mano Shuchitva and Deha Shuchitva also. Mano Shuchitva means here, see, like this has been my 11th year of Ayurveda practice, and I have not modified my practice, or I have not deviated from it, or never I have felt that Ayurveda is lacking something, because we have always tried to integrate many things. Any kind of technological support also we have taken, and we have moved forward. So this has happened everywhere. But the thing is, we should have a clear mind. That is, a clarity in our mind, or clarity in our thought is very, very important. So I think that is more related to the Shuchitva. That is, we say that Vishadattva should be there. So what is Vishadattva? Kshalane Vishadaha. We have that explanation by Hemadri. So we should have that Vishadattva. That is, we should have clarity over the subject. So that is very, very important. And also the method in which we have adopted. The adopted adopted method should be very clear for us, and we should have a clear vision. So clear vision is nothing but Shuchitva. Then Sumanasa, that is, we should have a good mind. We should have a humble mind. And whatever tensions are there with us, we should not carry that during our OPD practice. This is very, very important. So if these are there, then definitely so this will be a prerequisite for a Vaidya. One has to become a Vaidya, then these qualities should be there. Otherwise, it is quite difficult to become a Vaidya. So after knowing all these things, usually what we do, we usually when we see any kind of patient, for example, any patient comes to us only with a problem. They will not come with solutions, or they will not simply come to you. They have a problem, so for the solution, they come to you. So the first thing we usually do is we have to know the severity of the disease. That is, there are 4 types of classification of the severity. There is Sadhya, Yapya, Asadhya, and this thing, that is Varjay, that is which we cannot really take up. So we should first decide that what diseases we can treat. So that clarity should be there with us. So therefore, we should be able to classify the condition according to the Sadhya Sadhita. This is very important. And based on that, we should accept or reject a case. If you are going to accept or reject it, because success always depends upon how you approach a problem, right? So therefore, the approach should be either, so you should already know that whether I am going to accept this case or reject this case. If you are going to accept all kinds of cases which are, even asadhya, then definitely you will not have any success. Or sometimes there may be success, but with lot of difficulties, or you will have to accept the challenge and then go through. So, so you have to have some criteria for accepting and rejecting the case. So what are those criteria? One criteria is the prognosis. Second thing is willingness of the client, because that is very important. Willingness of the client for the procedures, for the acceptance of the Vaidya itself. Sometimes, however good you are, maybe you will not get connected with the patient. That is also there. So therefore, if the patient is willing enough to do any kind of treatment with you, then definitely there will be success. Somehow there will be some some kind of results coming in. Otherwise, if the patient is always complaining about everything, then it is quite difficult. Many times it has happened that the patients themselves give us time. They will say that, okay, you can read some more things, or you can probably, you can put in more efforts. They request us, and then they will wait for us, and then they will say that, okay, I'm ready to, do to be a experimental case also for you. So such willingness will be there many times. So that also comes under the Bishak Vashita. That is, whatever the Bishak wants to do, if he he has the liberty to do with the patient, then that will be a very important thing during the clinical practice. The next one is the affordability. Many times, all the therapies what we do, we may not be affordable by everybody, and it doesn't mean only financial affordability, but it also applies to many other things, like maybe family support, or it may be the age, or anything like that. So affordability includes all these things. The next one is the medico-legal aspect. Sometimes we should be very, very careful. Now, we may be very happy that we are getting a lot of cases for Ayurveda. Of course, yes, we should be happy about it. But at the same time, we should be always concerned, or also be a little, very alert about the medico-legal aspects also. In many cases, it may be a pediatric case, or it may be geriatric case, or it may be any simple case also. So we should be aware of the things what to be done at a certain stage, and we should have a very good network of people also who can help us at the right time, at the right situation. So this is also very important. The next one is the obligation. Sometimes for obligation purposes, we accept cases, or sometimes we reject cases also. That is, because we cannot, it has come from some this thing. Though it is, for example, it has happened with me that sometimes some a politician or a very influential person asks us that can you treat the case, or can you treat a case of oncology, related to oncology or something. Then we may not have, like, for example, myself, in my case, I am not very, very confident in treating cancer cases, CA cases. Therefore, it will be very difficult for us to accept it. But because of the obligation we accept it, and then probably we may not be able to do justice. So the areas in which we do not have much knowledge, better not to accept those cases. If you are very confident, if you know that yes, I am very confident in that area, then it is better to navigate. Otherwise, it is a waste of time for the patient and also for stress for you also. So therefore, these things have to be considered. So we always talk about health and disease. That is swasthasya swastha rakshanam and aturasya vikara prashanam. But we usually see that people come to us with the problem and they need solution. So the problem for us, this is the perspective from the patient side. They have a problem and they need solution. And from our side, what we have a roga in front of us. That is what is being seen by us. And then we should do chikitsa. That is the solution. So how do we do that? For example, I'll take a case of this case where there is a hypopigmented patch on the lips, on the elbows. It is very severe. So how should be the approach to a problem? Like, you know that this is a skin disease, okay, but what dhatu is involved, what doshas are involved, nothing we know. Only we know that this is a skin condition wherein there is hypopigmentation of the skin in that particular area. So how should be the approach of the problem? That is, in a simple way, in OPD practice, how are you going to immediately or quickly have a checklist? So the first one which we have to see is the hetu. So hetu, we know that either the problem should be an abhighataja, that is nija or agantuja. So it should be either abhighataja or it should be nija, that is due to dosha prakopa. So dosha prakopa can happen because of especially in skin diseases, it can be due to viruddhahara or divaswapna or anything like that. So in this case, it was regular intake of incompatible diet, that is having the curd and milk. In South India, this is a very practice that they mix curd with milk. That is, if the curds are very sour, then you usually add it with a little milk and then take. So this is one of the virya viruddha, and that leads to a lot of cases like this. And this is becoming very, very common nowadays. And here we know that this comes under is the samutthana. That is how the disease has come to this patient. That is very important. That is, whenever we see a patient, we should know that it should strike in our mind that how did he get this disease? Because, for example, we have to see ourselves in place of the patient. Like, for example, if I am sitting in that patient's place, then what are the things which can make me to get the disease? Like that, we have to think. So that is called as samutthana. This is how the disease has come to him. Exactly. So if you see here, that is the nija nidana, that is there may be some dosha nidana also, but due to abhighata there will be rakta doshana, and then due to vata prakopa and kapha vriddhi, this shvitra might have happened. Now this shvitra has happened, we know, but there are certain types of shvitra, that is hypopigmentation. That is, if it is in the rasa dhatu, then it is called as daruna. Then if it is rakta dhatu is involved, then it is called charuna. If medo dhatu, it is called shvitra. Only when it leads to the medo dhatu, it is called as shvitra. Otherwise, it is not called as shvitra. Generally, it is classified as kilasa. That is, any hypopigmentation is called as kilasa. Any hyperpigmentation is called as kushtha. So therefore, we know that the samutthana is already known that from where it has come, or how it has come, how the samprapti has happened totally. The adhisthana is also important. Where it has happened, the location is very, very important for us. So samutthana and adhisthana are the two important things which we have to see. Are these only enough? No. We need to know that one more point. It is called as the lakshana, and also to decide the sadhya sadhyata, we should know that how it has happened. That is, what kind of disease it is. So that is called as vikara prakriti. That is, here vikara prakriti means, vikara means disease, prakriti means the swabhava of the disease. That is, what is the nature of the disease? That is, how it is going to exhibit itself, or how it is going to expose itself in the patient. So the vikara has a certain kind of appearance. So what kind of appearance? What is the dosha prakriti or vikara prakriti? That is very, very important. Here prakriti doesn't mean the prakriti, that is doshaja prakriti, doshala prakriti, what we call vata pitta pitta kapha kapha vata and vata pitta kapha. That it's not the sapta prakriti what we are talking. Here we are talking about the dosha prakriti or the vikara prakriti. That is how the doshas are acting or appearing here. So therefore, based on that, the lakshanas will be there. So therefore, these are the three important things which we have to consider. After that, if we do chikitsa, then we will get success. That is, you can see that the dosha prakriti, adhisthana and samuthana were rightly seen, and then we could see that in the elbows and lips it had reduced in much better way. So therefore, in difficult cases also, if we are going to approach in a proper way, then definitely we will get the results. But are we sure of definite results every time? Many times it happens in our OPD practice that in one patient or set of patients it will work very well. For example, I also treat hypothyroidism. In hypothyroidism, we give certain set of medications, like based upon the prakriti and also roga bala and rogi bala. We give certain medications like Kanchanara Gokulu or Gandamala Khandana Rasa, or we also give Hamsapatyadi Kashaya. All these things we give. But sometimes with the same medication, some people will drastically, day by month, we can see that there is reduction in the TSH levels and their general health also will improve. And we can also taper down the dosage of the hormones, and later they will be fine also. But in some cases, what will happen, as on when we are giving the medication, they'll be fine. But once we, reduce the medications, once again it will raise up. The TSH levels will raise up. Or sometimes, even if we give our medications also, sometimes there will be no result at all. For example, in Prameha, we'll see that whatever medicine we give, it will not act at all. There will be no objectively seen results. Sometimes subjectively results also will not be seen. For example, in Ayurveda also, if you do not consider blood glucose levels or the the hormonal levels or even the blood parameters also, lakshana wise also, if you see, we will not be having much results many times. In Ayurveda clinical practice also, if you are seeing from the Ayurveda perspective also, sometimes there will be no much of chikitsa yasha. So sometimes this happens, sometimes it doesn't happen. So we will not be very, very definite about all results. Why does it happen? Because we do not apply the method, that is right method of analyzing the disease. So what is the right method? That is, roga can have lakshana and chinha, that is signs and symptoms, right? Lakshanas are symptoms and chinha is signs. So we should be able to rightly point out the lakshana and chinha in the roga. So at the same time, Acharya Charaka says that this method should be adopted for the good chikitsa. What is the method? The method is identifying the vikara prakriti, adhisthana and samuthana. So therefore, he says in the 18th chapter of Sutrasthana, Tasmat vikara prakritir adhisthana antarani cha samuthana visheshamscha buddha karma samachare. So this is called as Trivida Bodhya Sangraha. Bodhya means one which does the bodhana for us. There is one which can lead us, one which can give a marga for us, one which shows the path for us. What are these three things which are going to show us the path? It is, one is vikara prakriti, that is how the dosha or the disease is appearing to us, the nature in which it is appearing to us. That is one thing. Second thing is where it has happened, the location of the disease. There can be antaranicha. That antara means there can be a lot of customization here. That is, the vikara will not appear in the same way in all patients. It will be completely different. And the adhisthana also can be different. Based on the adhisthana also, this vikara prakriti will change. And then samuthana visheshamsha. Samuthana vishesha means the how it has come in. That is, there can be different routes in which it has come. It can be due to viruddha ahara. It can be due to karma also, purva janmakrita karma. It can be due to vihara janya. It can be ahara janya, or it can be visha janya. It can be due to visha janya. It also includes pollution, exposure to pollution or such things, or it can be due to some of the shoka, that is manasika vyadhis. Many things are there. So therefore, this antara will be there. So the samuthana also can be very, very different. So how it has come, what is the nature of the disease, and the adhisthana. These three things are very, very important for us to understand. Why I'm putting these things is because we need to have some strategies, and very, very small limited ones. We cannot have all the roga rogi pariksha to be done. All dashavida pariksha is quite difficult. Of course, it is included in our practice, but in day-to-day practice or OPD practice is quite difficult. So therefore, these three things are the principles which will guide you. So when we consider Samuthana, it is Nidana and Samprapti both taken together, as we know that Nidana can be Nija or Agantuja, and it can be due to Asapinjata Samyoga, Pragnaparada or Parinama, right? So this is a more theoretical part. So, but we can see that Aganantaranveti Nijam Vikaram Nijastatha Agantarapi Pravriddha. That is, we can see that sometimes because of the Nijavyadhi, the whatever agantus will come in. For example, we have jwara due to virudahara. But if you get exposed to some microorganisms or exposed to any other viral load, then definitely it will increase. So therefore, agantu nidana can affect the nija vikara, definitely. In the similar way, if there is a nija vikara, if there is a agantu vikara, for example, there is a exogenous condition, and then if your ahara vihara is not proper or your sleep is not good, then definitely it will, the nija dosha also will contribute to that. So therefore, that anubandhatva will be there. That is, it will be interlinked. That is, both nija nidana and the dosha nidana are linked together. Nija nidana and agantuja nidana are interlinked together. So coming to the samprapti, you can see that there will be swatantra vyadhi or paratantra vyadhi. That is, there can be a straight line in which you have, for example, you have pratishaya due to exposure to cold, then you have kasa, then shvasa. This is a straight line. But many times there can be a paratantra vyadhi also. That is, for example, madhumeha. That is, one dosha can affect in a different way. That is, one dosha can be pravriddha, but the other dosha will be affected due to the marga varana or something. So in that kind of samprapti, usually, especially in marga varana samprapti, the appearance of the disease will be a little different than what we usually consider. Especially this happens in Krisha Pramehe. That is, in Krisha Pramehes, you will usually come to us with weight loss, but that will not be considered much because in general it is not considered. They only consider the blood glucose level. They will get to know that I have prameha only when their blood glucose levels are high, but they will not be much concerned about the weight loss or their appearance or how the disease is progressing and such things. So therefore, in that cases, many times vata will be affected more. So therefore, the more than treating kapha, we should treat vata. If we consider prameha as a kaphaja vyadhi and we start treating with or the general medications which are having all kaphahara, that is, or which are medohara, then definitely it will increase the vata, and therefore they will be getting affected more and more. So therefore, in that case, we have to be very, very careful. That is how the samprapti is happening. That is, whether it is a swatantra vyadhi or paratantra vyadhi, that needs to be identified well. Adhisthana, as we see that Adhisthana Antarani can happen, that is, it can be due to dosha sammurchana, or it can be in the samshraya sthana and vektasthana, what we call. That is, where the disease is exactly there. That is, whether it is in the dhatu, it is because of the mala, or it is only in the level of the dosha. And also we have to see that whether it is, where is the spectrum of the disease, whether it is only sharirika or either it is manasika, or it is both. Both the things have to be correlated well. Many times in these, in this era, we see that many of the conditions are chronic conditions, especially are connected to Sharira and Manasa. Even the acute conditions many times are related to Manasika Vyadhis also, or Manasika conditions. So therefore, we can see that there will be same Adhisthana but different manifestation. That is what is called as Adhisthana Antarani. That is, in the tvacha itself, we have many diseases. That is, it can be due to rasa, rakta, mamsa, meda, asti, or any dhatu if you take. It can also, any pradoshaja vikaras have this adhisthana in the tvacha. But the underlying factor can be anything, starting from rasa up to the shukra, right? So therefore, this will be always there. So therefore, because of the adhisthana antarani, we can have. But identifying the dosha samprapti and samprapti and the adhisthana, that will be very, very important here. So though the adhisthana is same, though you cannot only consider a disease as skin disease, that is tvacha vyadhi, and treat it. No, we have to consider what dosha, and how the samprapti has happened. Whether it is sarpana shilata, whether it is mamsota, whether kleda is there, whether there is visrupti, whether there is no kleda, whether it is ama, sama or nirama. These things have to be very, very clearly identified. So only then we will be able to identify the disease in a proper way, and then we can move forward. That is why it is definitely told that you need not name a disease. You have to see the dosha sammurchana and the samprapti, and then you have to treat the disease. So this is about the Adhisthana and Chikitsa. We can see that the Adhisthana plays a very, very important role. We can see that in Urdhva Gatra, if for example, if you are not able to identify the disease in a proper way, then usually what I do, in my clinical practice also, what I do is, if, for example, I have a skin disease, blindly, if like in general this thing understanding, what you can do is if the dosha is in the upper body, it is very, very chronic, then better to go for Vamana. Okay, just you close your eyes and do Vamana, definitely there will be a result. If it is in the Adho then Virechana will be very, very easy. But whereas if the Shotha is in Urdhva Bhaga, then Vamana is indicated, and Adho Shotha, Virechana is indicated. And once again, if the Shotha is in the Shirogata, that is, Shotha can be of different types. For example, sinusitis is also a kind of a Shotha, right? Or adenoids or something. There also, this Virechana will help a lot. So, Shiro Virechana will help a lot in any of the Shotha related to Shirogata Vyadhis. So, this kind of approach, that is Adhisthanavat Chikitsa, also it will be very, very easy for us, especially in OPD practice. Is very easy to decide, okay, you have this problem or in this region, better to go for this. So this is an easy formula. Coming to the Vikara Prakriti, as we know that the doshas can be either in the Pravruddha state, or it can be in the Prakopa stage. That is its own Swabhava. It can be Prakrita or it can be Vikrita. In Vikrita we have Pravruddha and Kshaya also, but usually Kshaya will not be seen much, like it may be very little. If you consider the percentage of diseases, Kshaya diseases are very, very less, especially nowadays. Apatarpana Janya Vyadhis are very, very less. Nobody is suffering with malnutrition, at least. Everybody is suffering with overnutrition. That is, we are taking excessive of protein, excess fat, or everything excess. But we find very, very difficult, especially in urban cities, very, very seldom we find that there is malnutrition anywhere. It is mainly because of the that is, Santarpana Janya Vyadhis are more rather than Apatarpana Janya Vyadhis. That is why we face so many diseases nowadays, because Santarpana Janya Vyadhis are more than Apatarpana Janya Vyadhis. So coming to the Sadhya Sadhyata, so we have to have that this classification also. Whether it is Sadhya, in that then Mrudu Sukha Sadhya and Daruna, if it is Mrudu or Daruna. In Asadhyata also Mrudu and Daruna we have to consider. This Mrudu and Daruna, that is, we can consider only two kinds, wherein this Mrudutva or Darunatva can be considered. So these first three things, that is the Mrudu, that is which is considered to be Sukhasadhya, and Daruna, that is Kricha Sadhya, we can definitely take up. There is no problem. But if you are only an expert, then better to take up the Yapya Roga, that is Mrudu Asadhya. Better to leave this Daruna Asadhya, because even if you are an expert, it's quite difficult, but with consent and also with the mutual understanding with the patient, you can take up Asadhya, Daruna Asadhya Vyadhis also, but you should be a little careful. But of course, if you are an expert, then you can take the Mrudu Yapya Vyadhis also. For example, I am more confident in respiratory disorders. That is why I take up the Mrudu Yapya Vyadhis. That is, we know that asthma cannot be cured completely, but we take up those cases and perfectly manage, or we are able to manage it confidently for rest of their life, not to have much of the complications and to avoid at least steroids. So that much we can do. So therefore, Yapya Vyadhis also can be taken on, but only if you are an expert. These two can be taken up by a practitioner of any sort of disease. It may be related to any specialty. You can easily manage these disorders. So before doing all these things, as we know that Rogamado Pariksheta Tato Nantaram Oshnam Tatah Karma Vishak Pragnam Jnana Purvam Samacharet. So what is this Jnana Purvaka? Jnana refers to this Vignata Shasita Yokta Pradhanam Vishakatrato, it is told, right, in the context of Vishak Dravya Upasthata and Rogi, this Pada Chatushtaya, it is told in Shodasha Kalabeshija that you should, the Vaidya is given a lot of importance. Why Vaidya is given a lot of importance is because he is Vignata, Shasita, Yokta. What all he has? Vignata means what? Vignata Aushadasya. Acharya Chakrapani comments there and says, Vignata Aushadasya, Shasita Paricharakasya. That is, he should know everything about the Aushadha. That is Vignata here. And then Shasita Paricharakasya, he should be able to effectively manage his staff. That is more important. That is his therapist, his receptionist, pharmacist, everybody. So that is important. Shasita, that is, he should be able to manage everybody. Then Yokta. Yokta means he should be able to apply his Yukti everywhere, not only in practice, or not only in his Roga Pariksha or anything. It may be managing also. So Yukti is very, very important. That is what we have to do. We have to do at that particular situation to also make sure that everything goes in a smooth way. That is, as we said in the earlier slides, that it should be ethical, practical, and also our practice should be trikalagna, that is, it should be relevant to the past, present, and the future. So such kind of practice, if we are going to want to do, then definitely we should have these qualities: Vijnasta, Shasita, and Yukta. So what all Yukti we should have? So these are the Yuktis. These are the components of the Yuktis which we should have. The first thing what we should have is the patient-centric approach. That is, we should have a thorough Roga Rogi Pariksha Vidhana. So that is important. That is, we should completely, that is, whatever reports they have, that should be kept aside. Usually that is what I do. So thorough Roga Rogi Pariksha has to be done. Very important. Second thing is personalized treatment based on the Prakriti. You should, though you feel that some of the medications are, if you are following the same set of medication, if you know that they will work very well, rather than that, you should have at least some modifications in your prescriptions. That is, if it is a Kapha Prakriti, then you have to change it. If it is Vata Prakriti, then you have to change. Pitta Prakriti, you have to make sure that Prakriti, whatever the patient is belonging to, that has to be considered while you write a prescription. Many times what happens is, we miss out. Like, we take a lot of history, we talk to the patient, we elicit all the complaints, everything we do. But later, while we write the prescription, we will just go through, okay, these are the symptoms and I'll be writing these many things, and we'll finish the prescription. Many times we miss out what the patient really wants, or what the patient wants actually, like what is his priority. That is, whether pain is his priority, whether discomfort, any kind of discomfort, or what is actually affecting his routine. Because what will make a patient to come to you, because nowadays everything is available online. Even your food is available online, your groceries are available online, work is online, everything is online. At the place where you are sitting, everything will be supplied to you. What will make the patient to ensure that he'll come to you, see you, talk to you, get examined from you, and take medicine from you, and also come for the follow-up? That is very, very difficult. Nowadays, that is a major challenge. A person coming to you. So if you want to make the person come to you, or if he is so much concerned, only then he'll come. Otherwise, they will not come. Especially in cities, this is the scenario. Only if it is the problem is concerning his routine activity. If he is not able to do something and that is obstructing him, he is not able to do his karma properly, that is why he will come to you. So that approach should be there. That is, we should know that only when the patient is in trouble, he'll come to us. Otherwise, if he is not in trouble, he will not come to us. So understand the intensity of the trouble. So therefore, we should be very, very empathetic. That is, empathetic in listening what the patient wants to tell us. And also we should have a trust. That is, this trust building is very important. It is not that we should be overacting, or we should be very, very soft and polite, but we should maintain distance. At the same time, we should be a little empathetic also. And also, we have to give a very, very clear lifestyle and diet guidance. That is very, very important. It should be clear, practical, and also implementable. It should not be simply for the sake of telling. If you say that don't follow Viruddhahara, and you just don't do any kind of Viruddhahara, you should take only Satya Ahara. If you tell like this, nobody will understand. You should be very specific, and you should be a little explanatory also. And if you want to give out specific things, kindly write it in a prescription on the back side or somewhere, so that the patient will remember it and practically do it for the rest of the follow-up time. So that kind of diet guidance has to be given, only which is practically implementable, and you should see yourself in his home. Whether you will be able to, if you are able to do it, definitely the patient will be able to do it. So always we have to think after writing the prescription that whether I will be able to take it. Many times patients have asked me that sir, have you taken this medicine, for yourself, or have you tasted this medicine? Many times we would have not done that. It's not possible for us to always taste medications and every kind of medication, of course, but it is important for us to at least know that what are the ingredients, how does it taste, and how does it appear, how should we consume it. All these things have to be known at least, or it is better to once consume and see, because many times the patients have a lot of practical difficulty in consuming the medications also. So that has to be very, very so when you know how to do that, or if you give practical tips on how to consume the medication, then definitely that will help a lot. So coming to the clinical excellence and documentation, this is also very, very important. That is, you should have good clinical excellence, but the documentation is also important. That is, you should have a structured case record and always use classical references with reasoning. That is, if you have given a medication, you should have some classical background based on that. You cannot simply say that, okay, there is a medication for thyroid. It is considered as like something like no thyro or something like that. Some brand has come. You should not say that, okay, only because it is for that I'm giving you. No, that logic should not be there. You should know what ingredients it contains. Even if you are practicing the patent medicine, you should know, you should have classical referencing of that particular medication. And you should have proper reasoning in your mind that why I am giving this particular medication. Then always better to use standardized prescriptions and also have a regular follow-up. And then the outcomes should be tracked systematically. That is because you should be sure that after this many days of medication, these are the things which will be an outcome. That is, you should be very clear about that. I usually practice this. I had learned it from some practitioner, that after every medication they will tell, he used to tell that after taking this, this symptom will come down. After taking this medicine, this symptom should come down, or at least there's some percentage you have to tell. You can you can under promise and have over expectation. That is okay. But if you under deliver and you create an over expectation, then that will be very difficult. So therefore, you should never over promise the patient. Never over promise, but always over deliver. That, for example, if the patient has a certain intensity of pain, for example, he has around out of the pain scale, if he has 2 out of 10, then you prescribe a medication which can manage even 4 out of 10 pain. Then it is easy. But you tell him that only it will decrease 1 out of 10 for next 3 days. But if he gets a little more result, then he'll be happy about it, and he'll come for follow-up. So this is a kind of you cannot say it as a gimmick, but it is one kind of trust building also. That you are not over promising. If you under promise and over deliver, it is okay. Everybody will accept you. But if you over promise and under deliver, then it will be a problem. So therefore, always track the outcomes systematically also, and you should have that this percent of percentage has been reduced, or it has improved, or it has increased. These things have to be told. Only then the patient also will have a proper understanding. You also will have a good understanding about that. So therefore, effective communication with the patient and patient education is also important. If you start doing your practice like this, then definitely the patient will start carefully listening to you. That is, you have to explain the Nidana and the disease in a simple way. That is, you have to have a very simple understanding of the disease, and then you have to make sure that, see, this is happening in you. Many times, many patients, especially in urban areas, they complain that many in the conventional system of medicine, they do not explain the disease. That is, after so many years, for example, a patient is suffering from diabetes, we usually think that they will know everything about it, because diabetes is a very common disease, or even it may be a kidney disease or any disease as such. But later we will come to know, or they will only express in front of us that till now no doctor has explained me as you have explained. So this is very, very important. So therefore, explanation of the disease, we should not just think that by default that people would have Googled. No, many people will not Google, or many people will not understand. Even if they have Googled, they will have done the search in the wrong way. So therefore, they would have got information but not knowledge. So they will be having a load of information but not proper knowledge about or proper understanding of the disease. So therefore, how whatever they have gone through these many years, forget about that. But we have to explain about their disease. This is one of the main key points for success of this thing. This is what I started doing in my clinical practice when I started my clinical practice, because I did not have any kind of background of Ayurveda, no family support, and anybody in my family was Ayurveda doctor or even a doctor, nothing like that. But these are the strategies which helped us. That is, trust building was the most important key point. So therefore, this effective communication in that explaining the disease in a proper way is very, very important. The second thing was the educating about the ahara vihara. For example, a patient is doing atyambupana, that is a lot of excessive of water he is taking in the early morning. That has to be done. And nowadays you can easily find out that, you do a Nadi Pariksha, you do all the Ashtasthana Pariksha, immediately you will get to know that definitely they will be doing some of the practices which are not healthy. So therefore, or taking a lot of millets only, or taking only little food, doing intermittent fasting in a wrong way. Many things are there, so these things were out of maybe lack of knowledge and overload of information, they'll be doing it. So therefore we have to reduce that. We have to give we have to make sure that there is proper knowledge and underload of information. We should not give a lot of information, but we have to give specific information which will give to specific outcomes. And we should set realistic expectations. We have to say that, see, your disease is like this. This comes under the Yapya condition. It cannot be cured. You should be mentally preparing the patient properly based on his sattva. If he has a avara sattva, please don't do that. If he has madhyama or pravara sattva, definitely you can say that, directly you can say that this cannot be cured. You can use these words. But if he is a avara sattva, then you have to change your style of expression and then make sure that you get them in confidence, and then you show some results. After that, you can say that, yes, see, you have to maintain it like this. Otherwise, they will be very in a depressed state. And also, you have to always encourage them. They encourage the complaints. That is, the patient complaints is very, very important. So therefore, whatever you also have to say that, see, whatever feedback you have, please give to me. Like if you take this medication, if you are prescribing a kashaya, you tell them that this kashaya will be a little bitter in taste. You have to add more water. In case if you are not very, very comfortable with this, please let me know in the next follow-up, or let me know in between. I can also give you an alternate for this. I can give a kashaya ghanamati for this. So such things also have to be properly explained to the patient. You should also give some options. And before doing any kind of procedures or any kind of examination, also you have to take the oral consent at this. For example, you have to say that what I am going to do. For example, if you want to examine a patient, then abdominal examination you have to do, udara pariksha. Then you have to tell that you can lie down. After you lie down, I'll be palpating your abdomen and then seeing if there is any other abnormality. So that will help me in understanding what kind of pain you have. You have to tell that and then do it. Never do any kind of examination without informing the patient what you're going to do. So that is very, very important. This is followed in conventional medicine in a proper way in many cases. Of course, many of them do not do, but especially in many other countries, this is followed very strictly. But in Ayurveda practice also, it is told that you should be, you should first Purva Vibhashi. Purva Vibhashi doesn't mean that you have to just talk to the patient first. It's not that. It means that Purva Vibhashi means you have to be explaining the things to the patient first and then do the procedure. So that is what called as Purva Vibhashi. So practice management and professionalism. So that is, you have to have cleanliness, Shuchitva, what we are talking about. You should have a well-equipped OPD space. That is, your OPD space should be well-equipped. You should have everything with you and also have alternatives for whatever you have. For example, if you have disposables, that's very good. Even for patient examination also, you should use disposables and make sure that you are following all the cleanliness parameters in a proper way. Forget about the NABH or ISO or anything like that. You have to maintain your standard for the patient safety. So that is very important. Second thing is punctuality and proper scheduling. For example, you should be very, very punctual. If you have given an appointment at 5:30 for your patient, you should be in your cabin at 5:25. That is a mandatory thing. You should not make the patient wait for you. Many times we see that many practitioners, including Ayurveda or conventional medicine also, purposefully they make the patient wait, only to make sure that, show that, okay, I'm busy or something like that. Please do not do that. That is a sincere advice, because having punctuality is very, very important. Be prepared, because if you are prepared, then mentally prepared, you will also be mentally prepared in that situation to see the patient, and the patient also will be very happy, and he can complete it at the right time, and you can also schedule the appointments at the right time for the other patients. So proper scheduling and punctuality, very, very important. Then both will be happy. It's a win-win situation for everybody, right? And the third thing is organized pharmacy quality. Always have medicines which are of standard for standard pharmacy, and also make sure that the packing and this thing is very, very neat, and also it should have proper labeling. It should have expiry date, manufacturing date, everything, because we should be also safe. Medical legally also we should be very, very safe, because nowadays we see that patients carry these medications to other countries, so then there should not be a problem. Or when we write any prescriptions, that if they upload it to their insurance companies and all, they should feel that, oh, it's so nice, the prescription is perfect and there's no complications in there, and it can be approved easily. So that should be the impression in the other people's mind. So such should be our prescription. Second thing what I have to tell you is, please calculate. You should know that how many tablets, or what is the quantity of the or unit quantity of each of the medications. For example, if you are giving the Soothshekhar Rasa tablet, then you should know that if 30 tablets are there in a box, then kindly prescribe it in accordingly. Like you can prescribe it as 101, that is 1 in the morning and 1 in the evening before food for 15 days. So write it like that, and it should be clear. The prescription should be very, very clear, because writing prescription is also art, and managing the pharmacy is also art. That is, the pharmacy person should, don't write 45 or 40. You know that only 30 tablets are available, then what will happen? He should give 60 tablets. 60 tablets are given, then what he should do with the other 15 tablets? It will go waste. Or probably 25 tablets will go waste, and then it will remain. Then in the next follow-up, you will not be able to, and the patient will say that you had prescribed only 30 tablets, but the pharmacy person gave me 50 or 60 tablets, then remaining tablets are there with me. So many times the medicines will go waste, even in the writing the especially Arishta, Asava, etc. Many people do this mistake. They feel that it is 500 ml bottle. No, many of these standard bottles is 450 ml. So therefore, classify it properly. Please write it. Like for example, 10 ml you are giving daily at night after dinner or something like that, asava, then give it for 45 days. Simply. So then for 10 into 4, 10 into 45, 10 ml into 45 days, 450 ml will be over. So therefore, you will also know that exactly when the medication will get over. The patient also can follow up it in a very systematic way. Then you can expect outcomes, because when you have specific outcomes, your nature of medication, the product which you are giving also should be very, very specific. So the number of medications or the unit quantity what you are prescribing also is very, very important here. So having knowledge about the unit quantity is important. Please do not ignore this. And many times we feel that, why should I bother about this? No, you should bother, because you are the Vignata, Shasita, Yokta. You are the person who are going to use this Yukti. So Vignata Aushadasya. So it is not only the ingredient you should know, you should also know how much to prescribe, how to prescribe, and when to prescribe. Also, do not prescribe, understand their, lifestyle, their work, and then you can prescribe. For example, we are working in a college. Is it possible for us to, consume a medication in the afternoon? Not possible. So please write the timings also, that when is it possible. That is what I repeatedly have been saying, that please see yourself in the patient's place. Then you will understand that whether the patient will be able to take it or not. So after you write the prescription, you find yourself in his place and think that, okay, will I be able to take if I am that person in that time? Then you have to prescribe it. So if a patient is having night shift, please do not write medications in that time, because it is not possible for him to take. Then he'll skip the medicine, he'll not have results, and he'll complain back. So therefore, always take an account of his or her timings, and then prescribe the medication. So accordingly, if she's a housewife, a homemaker, or something, definitely you can give it in the afternoon, evening, or any time. But if it is a student, for example, children come to us morning, making them ready and sending them to school itself is a difficult task. If you give 2-3 medications in the early morning, definitely no parent will be able to give it. Therefore, it is important to give the medications at least in the evening, as evening they'll be a little free, calm, and they can also take time to give the medication to the patient, to the child. So in that way, we have to modify it. And also giving the prescriptions in muhur is very, very important. Acharya has already told, even in Ashtanga Hridaya, it is already told that Shwasa, Kasa, and Hikka, or any kind of respiratory disorders. Shwasa, Kasa, and Hikka, when you consider, you have to consider all Rasagata and Rasagata Vikaras, and also all the Shwasa related this thing. There is respiratory disorders, or even related to Shalakya. There are, or any kind of acute disorders, because Shwasa, Kasa, and Hikka are the acute disorders, right? Because you have every minute you have a symptom. It's not that if you have kushta, it is chronic, and you need not bother. The routine is not affected. But when you have shwasa kasa, you cannot do anything else. It's an acute condition. So in acute conditions, please do not prescribe 101 or 111 in this way, or BD, TID. This will not work. You have to give the patient the medication at least half an hour once or 1 hour once. Then the medicine will work. Many times it happens that children come to us with fever. They'll say that, okay, you had prescribed Amrita Arishta, we gave it, but nothing happened. That is why we had to go to allopathy. Why do they go to allopathy? Because we have not prescribed prescribed the right medication, but we have not prescribed it at the right dose and the right time. So if you prescribe Amrita Arishta itself every half an hour or every 1 hour, then definitely it will have results. Nothing will happen. No complications will happen. It will not produce heat or something, and no complications will happen. You can do it. Anyway, you also have to have one thing in your mind. See, for any parent, administering the Amrita Arishta every half an hour once is an impossible thing. Nobody will do that. But if you have written it as every half an hour, at least they will give it every 1 hour. So therefore, the Aushadha Pramana will increase, the frequency of medication will increase, and definitely the Jara will come down, or the Vyadhi will come down. So therefore, in that way, we have to manage it. While prescribing, you have to make sure that, okay, what is the mentality of the patient? But at the same time, you also have to make sure that if the patient gives it every half an hour very punctually, then also it should not produce any ill effects. And you have to give it. So understand the mentality of the parent and the child or the patient, and then prescribe the medication. That is very, very important. One more important thing in the professionalism is referral or referral networking. In case if you feel that you are not able to handle it, or if it is beyond your expertise, then please refer to your own colleagues, or if you anybody who you trust and who has a feedback mechanism. That is, after you refer, they should tell you that, okay, this has happened, or you only can call them and ask that what happened with my patient. This is very, very important. And second thing is CMA updates. Like, you should have always, continued medical education, because many things we will not know. Many brands would have come, many pharmacies would have brought in many new formulations, or sometimes many doctors would have, done a lot of modifications in their practice, and they would have got a lot of success. All these things would be shared in the CMEs. So participation in CMEs, local programs, associations, and webinars like this will definitely help you in increasing your or enhancing your knowledge. Sorry, I think there is a network delay. the strategies which we have to adopt while making sure that we have a successful Ayurveda practice. So what happens is many a times we you know uh, yeah. So we were speaking about the exact strategies what we have to adopt. So there were another two, three slides which I had to present. Mainly, it was related to the successful Ayurveda interventions what we usually do, like especially in my clinical practice, what all I have done. So I'll just list out some of the important aspects which I have adopted as a strategy. The first thing when I started my Ayurveda practice, what I did was I started networking with people and also making sure that you know um, how I can build up my practice in a ethical way and practical way so that I get follow-ups in a proper way. Getting follow-ups is very important rather than new patients. For example, you start your practice at the day one. For example, from tomorrow, November 1st, you are starting your practice. You have inaugurated your clinic. What will happen in the next 1 month? You would have invested a lot of things, and also in your mind, it will be there that at least should have a target. So you have to set a target, of course. But many times it may work or it may not work. So what we have to do is we should have a certain strategy for that. For example, I also advise my students, especially my students who bring in their practice. What I do is, as a senior practitioner, first thing what I do is I send the pharmacy representatives for their inauguration. I at least send 20 to 25 pharmacy representatives for the inauguration of their clinic. This is what I have started for my students. Why I do this? Because one thing is the clients who have come there, or for example the relatives, usually for the inauguration they will be have called their relatives, more of their relatives or friends or people who are in and around. So they should have an impression that this person who is starting this clinic is professionally having good network. So therefore when representatives, pharmacy representatives visit them, and then they call him, sir or madam, and then give their respect, and then they give their, explanations, and their presence is itself will make a lot of difference. Then the patient will, and the persons who would have come for the inauguration, definitely they will think that yes, this person is professionally sound. Then they will start coming up for the follow up or for the consultation. This is one strategy. Second strategy, what I had done is, for example, we have a chronic patient of Prameha. What we usually do, we usually prescribe certain medications for around 15 days or 1 month, and we'll say that I'll prescribe this for these many days. Let us see what will happen after 1 month. You can get a blood test then and you can come back. This is the general practice. But what I did was I modified this a little. I have, for at least 5 years, first 5 years of my practice, what I did was I was calling the patient every day. Like for example, Asanadi Gana Kashaya, there is a ready Kashaya available. There is 450 ml bottle of Asanadi Gana is available that you can prescribe. But what I used to do is I was calling the patient every day to my clinic, preparing the same Asanadi Gana Kashaya, like around 50 ml I used to prepare and give it to the patient. Like I'm giving an example of Prameha. Like that I have done it for all other diseases also, any chronic disease as such. So calling for 50 days, you tell that 50 days you have to come. Charge only 50 rupees. 50 rupees is a minor thing for 1 day, but you will earn more. For example, 50 for 450 ml of Asanadigana will cost 300 rupees. But if you give the same kashaya every day, and you if you put in your efforts, then definitely the patient is paying you more than what you can gain with the asana by selling the product, and you will get more results. Second thing is you will have more feedback. There is what we call as patient complaints. That is, every day you have a feedback. Every day you can check his weight, you can ask him, you can know his routine, you can elicit the nidana. Because in one consultation, definitely it is not possible to assess all the nidanas. It is not possible to assess all the Roga Lakshana or even Rogi Pariksha to be done in one consultation is quite difficult. Therefore, repeatedly, if the patient is coming to you daily, then you will be able to elicit the patient in a very well way, and also you can modify the things however you want. And at the same time, I have always seen that whether the patient has got complete results or not, at the same time, meanwhile, while he is coming to you, after the trust has built in, he will bring in a lot of other patients. Why I am telling you is the topic is related to a successful OPD practice. That is why I am considering the other aspects also of clinical practice. That is, it is related to clinical practice. Only if you have patients, you will have successful practice, right? Otherwise, you will not have. If no patients, no success. So therefore, the bringing in patients strategy of bringing in patients also is very very important. This is not marketing. This is pure clinical practice. So what you have to do, you have to make sure that there is better compliance with the patient, and at the same time, his family members will be more, confident about you, and he'll also get, very a lot of feedback every day in a very frequent manner. So this is one strategy which I adopted, and it gave me a lot of success because it gave me a good client base. In a span of 6 months, I could build a client base of 200 patients, who became our, very, very close to myself and my family. So in this way, this built up a very, long time trust building. So this is how you have to do this. And second thing is, do not change the location of your clinic very frequently. Have your clinic at the same place so that the people remember the place in that manner only, and do not change the appearance of the clinic every now and then. Let once you decide about the color and such things, appearance, let it stay as it is so that it will be easy for people to identify. The next strategy is the adopting or innovations in the clinical practice. One innovation what I did was like doing the Snehapana. Snehapana is a very, very difficult. In Panchakarma, what is the most difficult phase, most physical phase is the Snehapana. Nothing else is more difficult than Snehapana. So to simplify Snehapana, what we have to do, in cases of chronic illness, for example, prameha or kushtha or sthaulya, etc. What I used to do is I used to give tailapana rather than gritapana because gritas are very very having that pungent taste and very difficult. Nobody will be satna to it. I mean, the people because of that only they will not come to you further. So what I did was I started using tilataila, and then later I realized that some of the tailas, for example, there is availability of rice bran oil. Rice bran oil, like for example, if you consider the snigdhata of the oils, the least snigdhata oil is rice bran oil. For example, rice bran, that is the the paddy husk, whatever oil is present, it has least snigdhata. If you consider the proper snigdhata, the snigdhata is there in the more snigdhata is there in castor oil. So least snigdhata oil, if you prefer for Medo rogas, definitely it will act. And we know that there is some hormone called there is some enzyme called oryzanol and such things. That also you can tell to the patient that it is more convincing. The important thing is it is very tasty, and it is palatable. The patient will not feel anything, no nausea, no irritation, nothing. So I started using rice bran oil for Snehapana. 1 liter of rice bran oil, the good quality rice bran oil, costs you around 200 rupees. 1 liter. So with that, you can do Snehapana for 3-4 people, aram se. Therefore, it is very economical, cost effective, and also at the same time it is palatable, and it can be prescribed to the patient, especially with Sandarpanajanya Vyadis. So in Sandarpanotha Vyadis, I selected this. So this gave me a lot of edge in convincing the patient for Snehapana and further Virechana and Satsang. It is for Panchakarma specifically. And second thing was adopting the basti. That is, a basti chikitsa is more, once you make the patient more comfortable, basti is one of the panchakarmas which you can adopt and administer to the patient very easily and also very frequently, and you can get very good results in a shorter span of time. And it will also do the karma of virechana as well as basti. And we know that the outcome of basti is apadatala mastakam. That is, it can affect, it can influence from the father to the
Shiras. So therefore, by adopting Basti Chikitsa or being very, very skillful in Basti Chikitsa is a mandatory thing for a Vaidya if you want to practice Panchakarma. One thing. Next, another strategy what I want to share is, to maintain the financial, requisites of the clinic. It is always important to have some things which can fetch you some income when in your absence also. For example, if you are not able to, in your absence or in your setup itself should generate income for you. That is very, very important. For example, in allopathy it happens whether the doctor is there or not there. If a patient is getting admitted, even if the consultation doesn't happen, the billing will be happening, right? So in the absence of the expert, there is billing, there is income generation. So such strategies also are very, very important. For example, Swarna Prashana, or I also do a particular this thing called Shashanka Kirana Aushadha. Shashanka Kirana Aushadha is a concept which has been explained in Ashtanga Hridaya in Sharadrutu Charya. Now this is Sharadrutu going on in Kartika, and there is Ashwaja and Kartika Masa. In both of the Paudamis, you can use this. That is, there is a specific medication called the Shashanka Kirana Aushadha, or it is called as Shashanka Kirana Bhaksha. It is a payasa preparation which you have to prepare and keep it in the moonlight on the at least for 4 to 5 years, exposing to it to moonlight, and then in the morning you have to administer it. This works wonderfully for pitta vikaras. Pitta vikaras are very, very common nowadays. You can see that there is a lot of people, there are a lot of people who are suffering with acidity, gastritis, all the pitta. Why? Because Ratri Jagarana is more, when exposed more to light. Light pollution is one of the most, dangerous kind of pollution which is happening nowadays. And of course, it will increase pitta. Then people are short tempered nowadays because of that. The manasikata, they are getting more and more afflicted with pitta disorders. And also they are getting exposed to more heat, more light. There is especially, laptop, screens, radiation, etc. Once again, pitta is increasing. So pitta vikaras are more. Therefore, we are also seeing that menopausal syndromes are, quite, reducing the limit of the age limit. Earlier, menopausal syndrome used to be during after 45, but nowadays you can see after 35, people are getting menopausal syndrome. So for all these pitta vikaras, and also wherever, why we call pitta vikara, because wherever there is a sensitivity or there is a sudden reaction. For example, if there can be a sudden rash, or it can be a sudden acuteness of exacerbation of something, or it can be, allergy, sneezing, anything like that. Any acute manifestation, there is sudden manifestation, is the kshipratva is because of pitta. So only pitta has this capacity to express any, ill health, in a suddenly. So for reducing that, this Shashanka Kirana Aushadha works very, very well. So therefore, I have adopted this not only in Sharad Ritu, but in every Ritu. That is, in every Purnima day, I am going to administer this Shashanka Kirana Aushadha to people who are suffering with any kind of Pitta Vikara like this. There is any sudden onset, exacerbation of any disease they have. It may be respiratory disease, it may be menopausal syndrome, it may be gastritis, it may be acidity, it can be skin disease, it can be Manasika Vyadhi, anywhere where pitta is showing its shiptatva and visarpata, the spreading and a sudden onset. In those cases, Shashanka Kirana Aushadha works very well. And there it is simple. You can prepare it and administer it. Give it through your staff, and that will generate you a lot of income also. So this is how you have to generate parallel income also. Not only depend only on investigations or the commission which is given by the investigation laboratories. We have to generate our own system in which our system is getting developed, people are getting benefited, at the same time we are generating income. Swarna Prashana, of course, is a very important thing, but preparing your own, Swarna Prashana in a proper way and in a standardized way will fetch you more results and also more income also. So that will also add on to the sustainability of the your practice. The third important strategy which I want to share with you is preparing some of the anupanas. For example, the patients usually find it very difficult to find some of the products. For example, you say that please, take Pushyanuga Churna with rice wash water. Just preparing rice wash water is very difficult for them. But Pushyanuga Churna works very well only with rice wash water. Or even in cases of vertigo also, I have seen that it works very well. So what you have to do, make a powder of rice or this thing, give in a small packet. Tell them to add it in water and then consume it along with your this thing. So such products, small products you should have. Or also you will say that, please kindly take, mixture of, for example, there is acute piles. Then there is a small, gharelu nuska, what we call, that we usually give, like, the unsalted butter along with a little cardamom and sugar. Give immediately the next day, there will be no bleeding. At least that Atika Chikitsatva, that you should have. So please make sure that where it is available, or if you can supply it to the patient, it will be very, very easy. Or for example, the patient is suffering from vomiting. Then we usually prescribe Laja Manda. Now, when the patient has vomiting, where will he go in search of Laja? Not possible. Therefore, keep a small packets of Laja in your clinic, powdered along with a little bit of sugar, and also, or if you don't want to add sugar, you can just add a little cardamom, powder, and then keep it with you. Give them to the patient, and he'll happily take it and mix it with water and take it. So, Laja Manda is prepared. So immediately it will act, and he'll be very, very thankful to you for providing the anupanas along with the medications. So such kind of anupanas, whatever we prescribe along with the medications, have to be supplied to the patient in a very convenient way. If you do not supply things, or if you do not tell where it is available and how it is available, how to prepare, then it is quite difficult. Or also you can prepare, pamphlets. This I had learned from Dr. Il Mahadevan, who was there in Kanyakumari. He had prepared a lot of pamphlets like this, small checks, wherein how to prepare ganji, how to prepare rasam, how to prepare, the piya, how to prepare krishara, all these things. Many people will not know exactly how to prepare. They may be good cooks in their home, or they may be preparing many things. But when you say some certain kind of katya, they will not be able to follow properly. So many times this is very, very important, that how we are going to make the patient's life more easy in taking the medications. During the medication phase, there is the Atura Avastha, what we call. The patient should be made more comfortable. The medications and the Anupana, what you are giving, that should be available for him. Then only the Chikitsa will get completed. Otherwise, it will not. Because anyway, we are going not practitioners who are having all, everybody doesn't have the IPD setup. So we are not going to provide everything and anything and everything at the patient's bed or anything. We are mainly, because we are talking about the OPD practice. So in OPD practice, make sure that the patient has all facilities provided to them, and also information provided to them properly to be used. So these are some of the important strategies which has brought in a lot of success to me, and also success here in OPD practice. I mean, one, more follow-ups rather than new patients. That should be your main aim. New patients will come in when follow-ups increase. Definitely, they will bring in more patients. Don't use a lot of money for marketing. I have seen that many of my of our juniors and all, they spend a lot of on marketing, on Just Dial, on on creating the website, etc. That will not work. And please do not put in or please do not plead your patients to put reviews on Google. They will put it anyway. If they're very happy, they will definitely voluntarily put it. But don't ask. Please don't ask them to give a feedback on Google. If they are very good to you, like for example, if they already have trust in you, and then you can tell them that please you can visit our website or our Google portal and then put the review. But please do not request them that. Once you do that, your professionalism is lost. You do it voluntarily if they are happy with you, right? And don't depend upon the digital marketing. Or if you want to make only money, then depend upon digital market. Of course, it is having a lot of boom nowadays. But if you are dependent upon ethical and authentic practice, then better to, and sustainable practice for lifelong, then better to do organic marketing only. And also make sure that your sustainability is there, and you have to also maintain the professionalism and also maintain ethics in your practice. So these are some of the my experiences in my OPD practice, and what has brought me success, probably a little success in me, and it has also is also keeping my patients happy, and that's how I'm leading my practice in a good way. The another important point I have to tell you is uh, why I feel that is I am successful in my practices, because earlier I was dependent upon a teaching profession also for my livelihood initially. But after that, see now I am not into academics at all. Like I'm not going to any college, but I'm completely dependent upon my clinical practice. So this happened because my clinical practice has developed in slowly and gradually and in a sustainable way. That only has made me more confident in continuing my practice for my lifelong and completely leave my academic institution and then set up our own. As Madam was telling that we have to become more jobs providers than job seekers. Therefore, our phase should go from that way. That is, once we complete our BMS, it is not very easy to become a job provider immediately, but on a long run, at least in 5 to 10 years, you should become a job provider rather than a job seeker. So this should be our aim. So parallelly, we should have these goals in our life. So with these words, I would like to thank for giving me this opportunity, the Vishwa Ayurveda Parishad, and specifically Dr. Hetal Madam for giving me a wonderful opportunity to share my views with such audience. I see that many of our the doctors are also known to me. They are part of different organizations like Agnivesh Ayurveda Anushtana and other institutions, and many other practitioners from all over India have joined here. So it is my great privilege to have shared my experience in this particular platform, and I am very very thankful to Hetal Madam and also all the teachers and gurus who have come in my life, who have provided me the strength to practice Ayurveda, and of course, Lord Dhanvantri, who has always been there with me. One last important thing I would like to share is, along with all these things, one important thing is we should have a lot of faith in our Shastra. At the same time, our Dhanvantri. Dhanvantri is the Ayurveda Pravartaka. If we lose a little bit of faith also in our Dhanvantri, then the practice will not go well. So that is what will lead us to ethical and sustainable practice. So whoever leaves our hand, Dhanvantri will never leave us. Therefore, have complete faith, complete surrender with our God. Definitely, He will, do the uddhara of our life. So definitely, that will happen, and that has happened with me. And we should be very, very definitely knowing this point that um, we are not because of our efforts in this field, only because God has chosen to be in this field. We have not chosen. Definitely, we have not chosen this Ayurveda. Ayurveda has chosen us. So therefore, we should make complete justice for this Shastra. This is what I feel personally. Thank you. Thank you very much.
बहुत बहुत धन्यवाद। बहुत बहुत धन्यवाद डॉक्टर साहब। हेलो डॉक्टर हर्षा जी।
हाँ सर, हाँ मैडम,
जी जी, बहुत बहुत धन्यवाद
थैंक
आपका
यू मैडम, थैंक यू सो
कि
मच।
आपने बहुत अच्छी प्रेजेंटेशन, बहुत सारे पॉइंट्स को आपने कवर किया। और वन ऑफ द माय पार्टिसिपेंट्स है ना, अभी हमसे एक गलती हो गई थी तो रिकॉर्डिंग नहीं हो पाई थी। तो पार्टिसिपेंट्स ने याद करवा दिया कि मैडम रिकॉर्डिंग तो हो रही है ना। मैंने कहा हाँ जी हाँ जी बिल्कुल हो रही है। कभी कभी कुछ गलती हो जाती है ना। तो अभी एक बहुत इंपॉर्टेंट पीसीओडी का एक लेक्चर था, माय स्टूडेंट डॉक्टर प्रियंका शर्मा हिमाचल प्रदेश से, तो हो नहीं पाई, वो पता नहीं क्या गलती सी हो गई। तो बहुत अच्छी तरीके से आपने
अच्छा
इतने
अच्छा,
सारे पॉइंट्स को कवर किया है। मैं समझती हूँ कि आयुर्वेद के अच्छे दिन जरूर आएंगे एक दिन, और भारत के लोगों की पहली
डेफिनेटली
चॉइस
मैडम।
आयुर्वेद बने। उनको कुछ भी जरूरत पड़े तो वो सबसे पहले आयुर्वेद के बारे में ही सोचे, और वहां से उनको उनका सॉल्यूशन मिल जाए। तो ये बहुत बढ़िया, हमारे ऋषि मुनियों के द्वारा प्रणीत इस शास्त्र को हम कहीं ना कहीं सामान्य लोगों तक पहुंचा पाएंगे। डॉक्टर जयाश्री, आप अपना प्रश्न पूछ सकते हैं। डॉक्टर जयाश्री। हेलो डॉक्टर जयाश्री गिरीश सागर जी। अच्छा डॉक्टर साहब, एक दो क्वेश्चन चैट बॉक्स में है, आप ले लेंगे वहां से। डॉक्टर लक्ष्मी
हाँ
नारायण जी,
मैडम,
बहुत बहुत धन्यवाद।
चैट बॉक्स में मैं देख।
जी। उज्ज्वला जी ने
So there is a
पूछा है।
question that can you guide of rice bran oil in Snehapana? Yes. So this rice bran oil, I said that it is available, but one thing is we have to do a little shodhana of it. So what I do simple is I just add little manjishta and haridra. In for example, for 1 liter of rice bran oil, I use around 2 teaspoons of haridra and 2 teaspoons of manjishta. Add it, boil it well, and then heat it well, then filter it and use it. That's all. That is, I not do it like double boiling method I use, and then do it. That is, the paka is not happening repeatedly. Of course, I am not doing the sneha paka as such, but to make sure that there is no amatva because of the oil, I am doing this. So this will definitely help, and in especially in hypercholesteremia, and in obesity, in prameha, it has given me very good results. And of course, it is palatable also, and it is not very and it is very cost effective also. No cost on snehapana at all, almost very very minimal. In 100 rupees you can do virechana. So this is possible, and this concept was given long back in Agnivesha Ayurveda Anusthana. We had a guest lecture from a very eminent Vaidya from Ballari and hospital near that place, from a village. He was telling us that in 50 rupees I do virechana, in 100 rupees I can conduct vamana. Then we were astonished that how is it possible. Then he gave us some points wherein how you can make the panchakarma more and more cost effective. So therefore, that was a eye opener for us, and then we started exploring things, and then that's how we got to know that we can also adopt these things. Thank you so much.
जी, बहुत बहुत धन्यवाद डॉक्टर साहब। डॉक्टर उज्ज्वला ने पूछा है कि सर एक्सप्लेन अबाउट द तेल स्नेहपान विधि, और आपके लेक्चर की बहुत अच्छी सराहना की है। बहुत अच्छे अच्छे इंपॉर्टेंट पॉइंट आपने एक्सप्लेन किए हैं, इसके लिए धन्यवाद।
वही अभी स्नेह पानक का मैंने तैल पानक का वही मैंने ये किया. There was one question that whether rice bran oil is natural oil. Yes, of course it is. Of course, the rice bran will contain very less oil, but it is of course very minimal oil is produced with that. Therefore, it is not much available. In large quantities, it cannot be available. But many people think that it may be mixed with chemicals. But there are only certain brands which produce rice bran oil. So therefore, you can choose those which you have seen. For example, there are especially in South India, it is very easy to get oils because there are many industries wherein you can practically go and see, and you can purchase it. Therefore, nowadays that concept also has come up in urban industries where you have this this kacha oil, that is the natural oil or organic oil is produced in front of you. So with that source you can take. So comparatively, for example, tila taila, if you consider tila taila, if you want to get it from the the wood pressed oil, wood pressed processing units, it will cost you anywhere between 800 to 850 rupees for 1 liter. So it's very very costly. But whereas this one is more cheaper and cost effective also. Therefore, I think if you take it from a authentic source, therefore it will be authentic only. You can use that. And one more question is there on Shashanka Kirana Aushadha. That Shashanka Kirana Aushadha is a payasa preparation. That is, you have to take red rice, boil it well, add milk with to it, and then you add you have to prepare exactly like kheer. And this is very very in North India. It is very popular as there is a vrata called Kojagara Vrata. So in Kojagara Vrata, it is usually done. That is, it is kept in the moonlight, and then you consume it in the early morning or after around 12 or 1 o'clock. There is a nakshatra also told, especially in Sharat Rutu. And in North India, in many of the public places also, this camp kind of thing is done, and then it is administered to people. That's how I got the idea also. While I was doing BAMS, there was one Maharashtra Mandal who did this particular kind of camp, and then I got to know that this is a very easy preparation which is done. Of course, in large quantities also you can prepare. For that, usually Ashwatha Churna or Arjuna Churna is added, and then it is exposed to moonlight. So that is the key point. Only kheer will not help you, but Arjuna or Ashwatha Churna along with that will help you a lot. Shashanka Kirana means, of course, yes, the moonlight. Shashanka means moon, and Kirana means the moonlight. So therefore, it's called as Shashanka Kirana Aushada or Shashanka Kirana Bhakshya. Bhakshya it is called because it is a rice, it's a sweet. That's why. And this is explained in Sharad Rutucharya of Ashtanga Hridaya Sutrasthana.
जी बहुत बहुत
नमस्ते
धन्यवाद
सर।
जी
Sir, I mean, this lecture has opened our eyes regarding the small tricks which we can practice in our OPD. Like, have you told about Anupana? Those are actually, I think, the practical inputs. Like, as you said, maybe if I'm a patient also, I'll be thinking from where will I collect this rice, water and all that. Yes, sir. And these tricks actually, I think if we practice in our OPD, I think it'll be better. So one thing I had to ask you, you told me about this rice powder, no sir?
Yeah.
If we can make it into small sachet and then give it to them. So if along with Pushyanuga Churna, it has to be mixed with water and then used with the Pushyanuga Churna, is it?
Yeah, that way also we can do. Or else what I do is I give a small packet of rice only, around 10 grams of rice. So that they have to soak it in water. After 10 minutes, it will become milky white. Then just shake it and drink it along with it and discard the rice. That's how I tell them.
Oh, okay. And sir, about this rice bran oil snehapana, we have to do the shodhana. That's all. With what I mean, should what?
I use Manjishta and Haridra.
Yes, sir. Manjishta, 2 teaspoons of Manjishta and Haridra. We are supposed to boil it, and that's it, sir.
That's all. Like for example, of course, rice bran oil is an edible oil, right? You can be using it as a edible oil. Okay. But to make sure we are giving it in larger quantities, it should not produce any ama. For that, for amatva nirharana, we are going to use Haridra and Manjishta. That's all.
Okay, equal quantity and then boil it.
Yes.
Okay. Thank you so much, sir.
Thank
you so much.
जी बहुत बहुत धन्यवाद डॉक्टर साहब डॉक्टर उज्ज्वला do you want to ask
yes ma'am. Sir, thank you so much. Yes, very much informative session, and you have explained about that tela na sir. So tela for Vaman and Virechana both we have to give snehapana, like we give Ghruta, like that we have to give na.
Yeah. Similarly, like how you do our Arohana snehapana, similar way you can do it. But I have seen that it will get a little digested faster, and it doesn't produce much of this nausea also. There is no much of nausea, this headache and a lot will not be there usually. In many cases I have seen, but if they do not have sneha dvesha, definitely it will work well. It will not produce much of this, and then udgara bahulya also will not be there much. That that kind of pungent smell when you get the udgara, that will not be there. So that you can. It's more very very palatable.
Okay, sir. And that red rice and how much will be the quantity for that kheer na? You told rice and Ashwatha Churna, Arjun Churna, how much will be the quantity?
Usually, like the amount of paisa given to one patient is around 200 grams, or 200 ml. That much, that much will be the quantity which will be given. So based on the number of people you have for the the Shashanka Kirana Aushada, like that you can prepare. First, you have to prepare like the payasa itself. Like you have to just prepare rice, the payasa. However you prepare kheer in the similar way you have to prepare it. then you have to add Arjuna Churna. For usually what I do is, for per 200 ml of or 200 grams of paisa, I add around half a teaspoon of Arjuna Churna or Ashwatha Churna. This adding of Arjuna and Ashwatha Churna is not in the classical reference. It is an Anubhava, this thing. This was practiced in, in North India in very, in a very rampant way. And by just, observing the taste of the medication that they keep, then and by asking many other people, then I got to know that it is Arjuna Churna or Ashwatha which is used.
सर अश्वत्थ चूर्ण छाल चूर्ण और पत्र चूर्ण because Jamadagri sir used to tell when there is some medhya we have to give for babies on like Sunday, we have to give on Ashwatha Patra that rice and dal and ghee, whatever medhya ghee, that he used to tell. So that's why I asked this.
That is there, like Ashwatha, it's for Medhya Rasayana purpose, it is told. And also in Vatarakta, there is this thing, there is a reference in Vatarakta Chikitsa Adhyaya of Charaka Samhita, 29th chapter, about the this thing, usage of this Ashwatha Patra, like Ashwatha, it is told. Definitely they have not, used the word chal, that is the bark or this thing. But wherever there is a kapha or medo vikara, that is Avratan Margatvat Medaso va Kafasya. That is, if there is a Margavarana due to Meda or Kafa, in those conditions, you can go for Ashwatha, Arjuna, and many other, this thing they have told, the Kashayas they have told. So there they have also told Haritaki and Takra. This Haritaki and Takra they have also told. So along with that, they have used Ashwatha also. Therefore, you can see that these are all the medications which are told mainly for the Margavarana Janya Vikaras, and these are the things which are very difficult to manage, right? That is, Margavarana Janya Vikara only will be Paratantra Vyadhi. So these Paratantra Vyadhis are more tricky. Other Swatantra Vyadhis are easy to manage. Usually it will be either Sukhasadhya or Krichasadhya. Paratantra Vyadhis or this Margavarana Janya Vyadhis only are tricky. So in those cases, these are the Aushadas which will work well. And this, especially chronic diseases, these kind of Aushadas will give us a long-term benefit also.
जी बहुत बहुत धन्यवाद डॉक्टर साहब। डॉक्टर उज्ज्वला, बहुत बहुत धन्यवाद आपका प्रश्न के लिए। और अभी नेक्स्ट पार्टिसिपेंट्स, डॉक्टर साहब, डॉक्टर रचना ने कुछ उसमें सजेस्ट किया है, क्वेश्चन पूछा है, आप उसमें से ही ले ले तो अच्छा रहेगा।
Of course, she has asked two questions. First question is, what are the necessities in competitive environment to have as a like keeping in our mind to before opening a clinic. One thing is, before opening a clinic, do not invest a lot for your interiors, for your this thing. No, don't strategically invest only on the marketing part or the appearance part. Invest on the equipments or what all skills you have to have. That is very important. Second thing, invest on the ideas. Invest on ideas, because ideas only work. That is, ideas which are based on your principles and which are ethical. They only will work for a long time. Other things will come and go away. So therefore, always invest on your ideas, and that will make you more competitive. So that will keep you this, जैसे बोलते हैं ना, थोड़ा हटके रहेंगे, तो that क्या हटके है आपके इसमें, वो those are the skills. That is, if everybody is a BMS graduate, but what you know is more important. You can say that, okay, I have done Ayurveda, I have completed my BMS. But if any student comes to me, the first thing I ask them is, what you know, what can you do? Can you diagnose a patient? Can you diagnose a particular disease like this in this way? Can you do this particular procedure? Can you administer basti in a proper way? Can you convince the patient in this way? Can you handle a case wherein there is manasika doshas and also sharirika doshas involved? Like this, the skill of diagnosis, the skill of prognosis, the skill of convincing the patient, the skill of communication. These are the things which you have to keep in your mind. That is first thing. Second question what you have asked is whether we can have our own medications. Of course, we have the liberty. The government of India is has permitted us to. Ours is the only science wherein we are permitted to manufacture our own medications according to Ayurveda, whatever we have learned, and give it to the patients. But I prefer, especially if you are in urban setups, then better to have some anupanas and such things which are not available to have from your own setup. But it is better to have standardized products. If you have standardized products, it will be very easy for you, because the patient also have to get, for example, every time they cannot come to you only or your pharmacy only to buy the medications. It should be available everywhere. For example, if they shift somewhere, because now it is the lifestyle itself is cosmopolitan. So if they go to North India or anywhere, it should be available. So make sure that whatever prescription you give, it should be available elsewhere also. Don't make the patient dependent on you. If you make the patient depend on you, then you are more you're self-centric. You should make the patient Ayurveda dependent. That is our goal. They should become Ayurveda dependent on, and not you dependent, or the person dependent, or the practitioner dependent. That is very, very important, because they should have faith in Ayurveda. Even if they go to any other place, this medicine, if it is available, they will be very happy, and they will be having definite results with that. But if they do not get it, then they will lose confidence on Ayurveda, and they will go to some other conventional therapy or some other therapy, and slowly they may shift away. So therefore, that is very, very important. That is, make priorities. If you have a patient wherein you are going to give the medication only for certain number of days, and you know that they are only here, then you can give your own medications. But have both a mix of both proprietary and also your own medications. This mixture is very important. That is what is my concern. So what I have done nowadays is, I have earlier for around 8 years I had not used any loose products. That is, I used to give only syrups, this thing, everything which is packed, or which is in the strip or in a bottle packed only, no sealed opened. But nowadays what I'm doing is, I am purchasing from authentic pharmacies, like 1 kg or 1,000 tablets and such things, and then I am dividing it and providing it to my patients, provided that I know who are they, or where are they staying, or how many days, whether they'll be not complaining about this, because there'll be no manufacturing date, no expiry date, nothing like that. So minimum number of medicine you can prescribe, and of course it will be cost effective also, because that is your concern, that it will become very, very expensive, because private clinicians are making a lot of money because of that. But I have seen many clinicians taking more amount, charging more amount for the loose medicines than the packed medicines. So that's it. That is very, very unethical. I have seen many of them, and I have seen our teachers only doing it. That is, I think that personally, I feel that it should not be done, which is unethical. If you are getting the medicine in a lesser price, then please pass this discount to your patients also. That is how you can make ethical practice and earn good money. Otherwise, that money will not be with you forever. Definitely, that is definite. So that is why what I have done is, say, nowadays, like some of the Rasaushidhis are becoming very, very expensive. So the bulk packing medications, you can classify it, put it in small packets and give it. That will be cost effective. But don't charge heavier, more than what you are getting. Have Dhanvantri Bhaga or Rudra Bhaga or anything, but do not overprice it. That is our request. Yeah, there is one question that why Ashwatha and Arjuna in Pitta Shamak Kheer. Of course, that is there is no proper yukti. I think it is because of the the Bharga Varana, what is removed, and of course, Arjuna is also a very good Pitta Shamak. It is Hridya Dravya, and it specifically acts on the Rasadhatu. Maybe because of that it is indicated. But of course, there is no classical reference, and there is no logic built up behind that. That is why right now I am not able to explain it. Probably in the years to go, if we do a lot of research on that, we will get to know about that. Then how to counsel somebody for Langhana or Nidana Parivarjana? See, if you are specifically identifying the Nidana, then the patient will get convinced about that. And there are certain, that is why effective communication is very, very important. That is why I always suggest all my practitioners and junior practitioners, also students, to also do some course on the effective communication. There are many courses nowadays and certified courses from the SWAYAM portal or NPTEL. Please do a course on effective communication. And there is a portal called NPTEL. There is National Portal for Technological E-Learning. Go to that website or Swayam portal. Swayam is a this thing. It's no free of charge online courses. It is run by IITs. So they will guide you how to effectively communicate with people. It may be any profession. So learn these things. Do certain courses like that, which will give you a lot of inputs and also some strategies as how to convince the patient, what to tell, when to tell, and how to tell. So these three things, if you know, then definitely you will be a good, a good doctor. Because the definition of the doctor itself is like that. It is not that a doctor is a person who is who treats patients. No, the doctor is a person who can teach the patient on how how the lifestyle should be and how to modify his lifestyle so that there will be health regained. So that definition doctor will definitely correlate with the practice of effective communication. So Shodhana procedure for rice bran oil with Manjishta and Haridra, every time we should do this thing. No. Okay, like you can do it, at once. Like for 1 liter of oil, you add 2 teaspoons of Haridra and Manjishta, boil it well and keep it. Then you can use it whenever required. That's all. So in bulk, you can prepare and then you can use it. That we can do, definitely. For how many days Shankar Kirana is given? It is like Swarna Prashana. Every month, on every Purnima, you can give. This is how I am practicing. Since 6 years, I am practicing. I am getting very, very good results. Yeah, whenever we practice any medication, we have to definitely tell the this. This is a very good point. Thank you, Dr. Ujjwala, for sharing this. We have to definitely reveal the name of the medicine. If you are not revealing the name of the patient, then you are doing crime. This openly I can tell you, if you are not revealing the name of the dravya or name of the ingredients or name of the aushadha, then definitely you are not doing a ethical practice. However good you may be as a doctor, you are doing a crime, and you are definitely the the patra of having any kind of karma, bad karma, definitely. So please do not this is my sincere advice to anybody, even for my students or anybody I tell, please do not hide the name of the medicine. Why should you hide? Whether Charaka and Sushruta had hidden any of their this thing? No. Any number of how much ever effort you have been put, but all efforts are a combined effect. It's not that only you have studied and you have done a product. It's all the efforts of your gurus and also everybody who have. So definitely we cannot say that everything is because of our efforts. Definitely no. And that's why Ayurveda, earlier there was no concept of patency. This taking patency is a modern concept, and definitely personally I feel that there should be no competition in this particular field. Especially naming of the medicines, not revealing the medicines. This is a crime. The dosage of Shashanka Kirana Aushadha is around 200 ml. That's all. That is like the kheer, the total kheer. Of course, Dr. Anila has asked a question that whether it should be done only on Sharad Purnima or any other Purnima. Of course, it is done on Sharad Purnima only. That is the classical references for Sharad Purnima. But you can do it on every Purnima. I have done it, and there is no harm in doing it, because every Purnima there will be Shashanka Kirana because moon is more nearer. So all the kalas, the Shodasha kala of moon is visible and it is very near to the earth. So let us take the benefit of moon. That's all. Yes, the Dr. Ujjwala, the kheer should be kept under moonlight for at least 4 hours. At least 4 hours. You can keep it for more number of hours also. Many times it happens that in rainy seasons and all it may rain. But usually, what I have seen practically is I have been doing this since 10 years. So I have seen that especially after Chandrodaya. That is because I do it in Bangalore as well as in Mysore also. There is two different environments. In both the places, I see that once a Chandrodaya happens, the rains usually come down, and there may be a slight drizzling, but there will be no heavy rain as such. In only some of the times when there is a lot of cyclone or something, then this happens. Some things happen. There may be idhar udhar ho jata hai. But otherwise, I see that at least 4 hours of moonlight, you definitely will get it from Chandrodaya till next day morning. So you have to be vigilant. One important effort is that you have to be awake all night on Purnima day. That is one thing which we have to do from our side. That is the only effort we have to do. Of course, we have to do कुछ पाने के लिए कुछ खोना पड़ता है. So for the benefit of patients, we have to lose our sleep for one night. That is not perfect.
बहुत बहुत धन्यवाद डॉक्टर साहब। बहुत अच्छा इंफॉर्मेटिव लेक्चर रहा और बहुत सारे क्वेश्चन आंसर से सभी पार्टिसिपेंट्स ने अच्छा धन्यवाद किया है और बहुत अच्छी तरीके से डिटेल में वो सुनते हैं तो आगे भी पेशेंट्स के ऊपर अप्लाई जरूर करेंगे। जहां बनाने की विधि मात्रा और बहुत कुछ उन्होंने अच्छी तरह से डिटेल में पूछा है, तो मैं समझती हूँ कि ये बहुत यूजफुल सेशन रहेगा और अ, हम सब मिलकर ही आयुर्वेद के लिए एक बहुत अच्छा वातावरण बना पाएंगे, जिससे जिन महर्षियों ने इसका सृजन किया है उनके लिए कहीं ना कहीं हमारी कृतज्ञता होगी कि हम नतमस्तक है आपके लिए। और आपने बिल्कुल सही कहा कि बहुत बार ऐसा लोग बोलते हैं कि ये मैंने बनाया, मगर बहुत सारी बेसिक्स चीजें हैं सिद्धांत रूप में, वो हमें सभी को एक साथ में मिली है। तो सही बात है। हमारे साथ डॉक्टर निशांत शुक्ला जी भी जुड़े हुए हैं, वो इस बात में कुछ बात और ऐड करना चाहते हैं। आज हमने डॉक्टर श्रेयर्षा जी का बहुत समय ले लिया, तो मैं आपसे गुजारिश करती हूँ कि आप भी कुछ शब्दों में अपना बात को रखें। और कुछ समय बाद डॉक्टर निशांत जी का लेक्चर भी हमने रखा है, पहले भी वो हमारे स्पीकर रह चुके हैं। ओवर टू यू डॉक्टर निशांत जी।
नमस्कार नमस्कार मैडम,
जी जी
थैंक यू
नमस्कार।
मुझे समय देने के लिए। जैसे यहाँ उन्होंने बताया कि राइस ब्रान को यूज किया है एज ए स्नेह पदार्थ। तो बेसिकली हम जो सीड बीज है नेचुरल ऑयल्स उसी का यूज करते हैं। तो एक खास आप जो है वो अभी भी टीचिंग इंस्टीट्यूट के साथ जुड़ी हुई हैं, तो एक मैं सजेस्ट करना चाहूंगा कि एक पैरेलल स्टडी या फिर एक कंपैरेटिव स्टडी हो जहां पर घी से स्नेहन करे, तिल तेल से स्नेहन करे, एनिमल स्टडी पर करे, और उसके बाद जो आज हम तेल यूज कर रहे हैं उसको करें, और बॉडी के अलग अलग सभी पार्ट्स पर उसकी क्या इफेक्ट हो रही ड्यूरिंग ऑयलेशन थेरेपी, और उसके साथ अगर हम करते हैं तो जो बात बताए कि भाई राइस ब्रांड को संतर्पणोत्थ विकारों में यूज कर रहे हैं और उससे फायदा हो रहा है, तो एक एविडेंस, एक साइंटिफिक एविडेंस बन जाए। जितने भी हमारे टीचर्स यहाँ पर है और एजुकेशन इंस्टीट्यूट खास करके पीजी जहाँ पर हो, वहां पर इस प्रकार का प्रोजेक्ट वो ले सकते हैं और एक एविडेंस बन जाएगा हमारे पास कि भाई ये इफेक्ट होता है, इतना इफेक्ट होता है और इतना इफेक्ट नहीं होता है। This is suggestion from my side, humble suggestion, if anybody is able to do it.
Yes, sir. That's a
Over
very
to Hetal Ravi.
जी डॉक्टर हर्षा, आप कुछ कह रहे थे, बताइए।
definitely, madam. Many Panchakarma students do their research on Sneha Dravyas. They usually take the classical this thing only, but definitely they can take up as a research and then they can do it in their PG studies or PhD studies. Definitely, this will be helpful.
जी बहुत बहुत धन्यवाद। चैट बॉक्स में भी बहुत सारे पार्टिसिपेंट्स ने लेक्चर की सराहना की। आज मैं नाम नहीं बोल पा रही हूँ क्योंकि हमने पहले ही डॉक्टर हर्षा जी को 1 घंटा कह के 2 घंटा ले लिया है, 2 घंटा और बस होने ही वाले हैं। तो मैं विश्व आयुर्वेद परिषद के इस प्लेटफॉर्म से आपका तहे दिल से शुक्रिया अदा करती हूँ कि धन्यवाद करती हूँ कि आपने इमरजेंसी लेक्चर के लिए तुरंत अपनी अनुमति दी और एक ही बार पूछा और पहले ही स्पीकर मिल गया, वरना कई बार इमरजेंसी स्पीकर के लिए बहुत सारे स्पीकर्स को पूछना पड़ता है बहुत सारे कि हम समझते हैं कि व्यस्तता रहती है कहीं ना कहीं विविध एजुकेशनल कार्यक्रमों में। तो बहुत ही अच्छा लगा कि तुरंत ही आपकी हाँ हो गई, क्योंकि वन मैन शो है ना, कि मैं पोस्टर भी बनाती हूँ, इधर भी डालना है, उस दिन 2-3 बार रिमाइंडर भी डालना है नमस्ते करके, और फिर सर्टिफिकेट बनाना है। तो कई बार ऐसे आगे पीछे हो जाता है, और जैसे आज भी कुछ ऐसी व्यस्तता चल रही है, तो फिर भी आपने भी इतनी व्यस्तता के बीच में अपना समय निकाला, यहाँ आए, ज्ञान में हमारे बढ़ोतरी की और ज्ञान यज्ञ में आहुति देने के लिए बहुत बहुत धन्यवाद।
धन्यवाद मैडम।
जी
कोई
सब।
मुझसे गलती हुआ है या फिर कोई ये तो, और वेबिनार में थोड़ा ये हुआ, स्टॉप गैप हुआ, उसके लिए क्षमा चाहता हूँ।
नहीं नहीं,
You
बहुत ही बढ़िया है।
you are wonderful, sir. Thank you so much.
हाँ जी डॉक्टर सेठ जी,
थैंक यू
बहुत
सो
बहुत
मच।
धन्यवाद। और सबसे लास्ट में मैं शांति मंत्र ले रही हूँ, आप सभी म्यूट रखकर ही दोहराएंगे। ओम सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखात् भवेत्। ओम शांति शांति शांति। जी बहुत बहुत धन्यवाद डॉक्टर साहब।
धन्यवाद सर।
नमो नमः। विश्व मंगल की कामना के साथ हम सभी
धन्यवाद।
अपनी अपनी जिम्मेदारी आयुर्वेद के प्रति निभाते रहे, तो एक दिन बहुत अच्छे दिन आयुर्वेद के लिए आएंगे। धन्यवाद डॉक्टर साहब।